Before the success stories, the progress, there was you. You who made a choice to grow, to inspire, to overcome your own challenges. At NASM, we're in service of your limitless potential, because when you keep growing, we all get stronger, and we'll never stop making your journey our mission. Join the fitness leader. Become a fitness leader. Become a certified personal trainer.
You're listening to the Physique Podcast with Andre Adams on the NASM Podcast Network.
Hey everyone, welcome back to another exciting episode of the NASM Peak Physique Podcast. I'm your host, Andre Adams, NASM Master Trainer and IFBB Physique Olympian. Today, I'm going to talk about why you're seeing the sudden uptick in trend in blood pressure medications within the bodybuilding community. I've got a lot of questions on this over the past few months, and it's definitely a trend that I've observed, creating a little bit more buzz in the industry. So definitely wanted to hop on here, shed some anecdotes and insights from both personal experience and then also from, a lot of medical professionals that we work with. So let's kick things off. We're going to dive right in here. And the first question I want to address is, why do bodybuilders take or consider taking blood pressure medications, and why is there this sudden uprise in the bodybuilding community? Well, for one, if we stop and think, there's a large degree of athletes that are taking, exogenous hormones or performance enhancing supplementation. And in addition to just the general, we'll call it intensities of contest prep, right? So really intense training, really intense dieting, all these things can cause different issues throughout the body, right? It's a lot of extra stress and strain on different organs and body, different parts of the body. If we think about specifically with those individuals that are using any form of AAS, that's going to be your anabolic androgenic steroids, TRT, right, even under medical supervision, or any type of performance enhancement drug. These things can have the tendency to cause a bit of peripheral edema, water retention, and any of this increase in fluids within the body can certainly lead to things like high blood pressure, right? So more volume, more hemoglobin, right? Just a higher degree of blood volume or thickening of the blood. So that's one common reason that you'll see a lot of bodybuilders either get prescribed by their medical doctor or reach out to consult to see if maybe they should be on a blood pressure medication. Now, if we back this thing up to, early days of bodybuilding, 80s, 90s, even early 2000s, information was not as widely available. So today, right, it's a lot more common knowledge, we'll say. There's a lot more publicly available information. You can go right to PubMed, look up case studies and research papers. Whereas in the 90s, this thing was still very new and there wasn't a lot of informal or tribal knowledge out there. But now, over the years, we fully understand that there's certain risks and additional stress that's placed on the body, and we want to protect these systems, right? So a bit of preventative maintenance could be one reason that you might want to consider a blood pressure medication, lowering the risk of, steroid-induced cardiomyopathy, and just really overall relieving stress and strain on the heart and kidneys to improve overall health, longevity, and reduce your risk of things like a heart attack or a stroke down the road, right? When you're young, you're not really thinking about these things because your body's a lot more resilient, right? There's a lot more elasticity in the blood vessels and the cardiovascular system. But as we age and we start to fatigue some of these systems within our body, it becomes more and more important to look at the big picture, right? And now that we've kind of talked about, why some bodybuilders have resorted to this, or consider taking a blood pressure medication, let's touch on, what are the potential benefits for those bodybuilders or those athletes that are taking some of these medications. And again, these could be doctor prescribed, which maybe you went for your annual physical and they said, hey, you've got high blood pressure, you're in this pre-hypertension range. We're going to prescribe this. You've got a you're predisposed genetically, you got a family or a personal history with it, we're going to prescribe you this. However, I do highly encourage everyone to be proactive, right? If you think you might be at risk for high blood pressure, or you've got some of those symptoms from the dizziness and, headaches and things like that, not a bad idea just to check it, right? And if you start to see directionally that trend elevating or going up over time, it's going the wrong direction, talk to your doctor about it. So now let's talk about some potential benefits for individuals that are taking blood pressure medications. So what things could you expect, right? Well, for one, we just talked about some of the issues and the drivers behind it. Well, we can reduce some of that by reducing pressure on the kidneys. So a lot of people, I would say, just from experience and talking to a lot of athletes, they don't necessarily make the connection between kidneys and blood pressure, right? Kidneys and heart. And they're, two sides of the same coin. If your blood pressure goes up really high, directly going to impact the kidneys over time. So I'm going to break down a little bit about how the kidneys work and how they work to filter out, some of these metabolites and phosphates and things like this out of the bloodstream, and why the blood pressure being elevated for extended periods of time can actually exhaust that system, right? So each kidney has around 1 million filtering units. They're called nephrons, and they contain smaller kind of web-like structures called glomeruli. It's a funny word to pronounce. And they filter, the blood into these smaller mechanisms called tubules before they return back into the system, right? So again, you've got this filter unit, that's your nephron, you got these glomeruli, this kind of web or mesh looking mechanism within there that then filters the blood, removes some of those toxins and metabolites, and then returns that blood back into your system, right? Now, these things are very small and they're highly sensitive to changes in blood pressure. So if think about your heart is a pump, right? So your heart is pumping blood and you're slamming all of that pressure, all that blood against these tiny millions of little nephrons or filtering units. And over time, what happens, just like any other system, is you can exhaust those, damage some of them, and then you ultimately begin to reduce kidney function over time. Now, for bodybuilding, there's many reasons why kidney function needs to be optimal at all times. One is the high protein diet, right? So to be able to process the high amounts, and when I say high protein, just to give you guys some context there, you'll see this debated all day long in different case studies, textbooks, research papers, and they'll go as low as like 0.82 grams per kilogram of body weight. There's really not a bodybuilder on this planet that's going to maximize their potential at that low of a protein intake, although that's what the textbooks might tell you for an average individual. What they're not telling you is that for individuals that are heavily muscled or individuals that are also taking exogenous amounts of hormones, your body's in this super physiological state. Muscle protein synthesis is through the roof, right? Much higher than an average person. So you're able to metabolize and synthesize much greater amounts of protein. But the trade-off is that's also placing more stress and strain and demand on the kidney, right? It's got to keep up and be able to process that faster. Now, the second part of that is actually the training. So when your training is very intense, you're breaking down amino acids from the muscle tissue. Again, right? Think about those extreme cases like, rhabdomyolysis, right? Rhabdomyolysis. And if you think about those extreme examples, again, the kidney can't keep up and process removing those toxins from the bloodstream fast enough. So these are some of the reasons that we want to protect the kidneys over time to avoid stage 1, 2, 3, 3A, 3B. We don't want to get to any of those, stages of kidney dysfunction over time. Now, again, with less blood pressure, stress on the kidneys, they're going to be more efficient at removing toxins from the high intense training, the high protein diet. When they're damaged, again, they can't keep up. So you can ultimately put your body into a state of toxicity over time, right? Now, another advantage of some of these medications, and this depends on the type of blood pressure medication, is that some of them have a tendency to inhibit or offset aldosterone, right? We'll call it buffering aldosterone. Now, you guys have probably heard me speak of aldosterone on some of our previous episodes, but just kind of high level, there's many different reasons that your body might produce or regulate aldosterone, which is ultimately, put out by the kidney. There's a feedback loop that's monitoring for levels of things like sodium and water within the body. And aldosterone is going to actually cause your body to retain more, right? So a bit of edema of the sodium and water, right? Now, if you've got too much of this, you can imagine where that edema is going to put more fluid in the body, more retention, and then ultimately increase your blood pressure. So if you can buffer this and hold it within a more regular range, that's also going to help offset some of the high blood pressure and again, remove a bit of strain off the kidneys and heart. And then the other thing, right, when we think about reducing stress and strain on the heart, when we think about just some of those systems in general, the heart is also very sensitive to contest prep in general, especially when there's the use of exogenous hormones involved. And what you'll tend to see, there's so many studies out there. We've even had some by some of our NASM subject matter experts over the past year or so. Highly recommend checking those out. But, you know, when it comes to the heart specifically, there's a risk for left ventricular hypertrophy. We're going to summarize that as just LVH due to, you know, steroid-induced effects, right? So thickening of the walls and the tissues around that left ventricle of the heart because it's working harder. Now, one of the other reasons that you'll see some of this hypertrophy within the heart is because of the cardiac myocytes, right? They also contain androgen receptors, very similar to skeletal muscle. So if you're taking anabolic androgenic steroids and you're signaling to those receptors to grow, and you've got some of those receptors within the heart, it's also signaling them to grow as well, right? So you get a bit of hypertrophy, which makes the heart, you know, I don't say less efficient, but it's making it work harder, right? It's placing undue stress on that system. And one other thing that I'll throw in there too, just heart related, right? We've got renin-angiotensin systems. We'll just summarize that as RAS. And this plays a significant role in regulating that left ventricular hypertrophy. And some of the hypertrophy can be mitigated by upregulating that local RAS, right? That renin-angiotensin system expression. So there's some different things and mechanisms by which these medications can help overall health, help protect the heart, relieve some stress and strain on the kidneys. Guys, if you're just joining us, I'm your host, Andre Adams. This is the Peak Physique Podcast, and we are talking about why we are seeing this kind of uprise, right? This trend in the bodybuilding community with blood pressure medications and what you guys need to know. So we covered some of the why behind it. Let's go a little bit deeper. Let's talk about some of the potential risks of blood pressure medications. Now, again, as with any medication, talk to your doctors, right? This can vary wildly by the individual, so we'll say the person, and of course by the medication and type. And your body might respond better to one form of medication or another, or maybe you can work with, you know, a natural doctor like my good friend, Dr. Indy, to go a little deeper and maybe do some mineral rebalancing and avoid medications, right? So there's plenty of different options. But when we think about potential side effects of most blood pressure medications, some of the ones that stand out to me are things like dizziness, right? That could be a state where your blood pressure is maybe dropping too low, or you've got this erratic curve of blood pressure. URI, so upper respiratory infections, some back pain is commonly reported, potentially nausea, hypoglycemia, with things like beta blockers, sexual dysfunction or ED can be a side effect, obviously unwanted for most. And then even things like insomnia, right? The issues with nightmares or just, you know, not being able to get a deep, restful sleep where you're getting those deep stages of REM. And then even peripheral edema, so a bit of swelling has also been reported in some cases. But I would say the most common one and thing to look out for is definitely dosing, right? So if your blood pressure is dropping too low, definitely want to make sure that you're not getting any hypotension issues. And that's something that your medical professional will help optimize for you, right? But there's got to be that feedback loop. Now that we've kind of defined all of the context in which we're seeing the blood pressure medications, now let's talk about what are some of the common types of blood pressure medications. And this is some of the more important stuff I want you guys to take away from this episode. We're just going to go down the list. I'm going to list off the most common ones and then things that I would say are most appropriate for bodybuilding, but contingent upon, again, consulting with your medical professionals. Let's start with beta blockers. So how beta blockers work, pretty simple. They bind to the beta-1 receptors and they inhibit or slow down your heart rate. Right, so if you're getting these hard, fast contractions, it's relaxing that, it's slowing down the heart rate, reducing forced contraction, and then it's ultimately lowering the stress on the entire vascular system. Now, that might be good for some individuals. However, when we're thinking specific to physique outcomes, maybe it's not great for things like intense training, right? You might want more powerful blood flow and contractions. You might want a little bit more, faster heart rate when you're trying to burn calories or trying to exert maximum force. So beta blockers, they tend to not be the number one choice when you're in an athletic competition, not even just bodybuilding, but just, a high intense athlete in general, performance athlete included. Next one on the list is probably one of the most renowned and common ones that you'll see in bodybuilding, and that's going to be your ACE inhibitors. And there's kind of two classifications. I'm going to break them apart. But ACE inhibitors stand for angiotensin converting enzyme, right? Now, these inhibitors are medicines that help to relax the veins and arteries to allow more blood flow, right? So this is going to effectively lower blood pressure. ACE inhibitors prevent an enzyme in the body from making angiotensin, and that's angiotensin 2, a substance that narrows blood vessels, right? So if you can buffer this enzyme that is constricting blood vessels and allow them to relax, this is obviously going to have a direct impact on total blood pressure in the body. One thing that I like about the ACE inhibitors is that they're very time tested. They've been around for decades. Most people don't even know they're taking them, right? Very minimal side effects, if any. And it's something that you can use as preventative. And again, I'm going to pause there for a second because a lot of people, again, are maybe thinking, well, do I really need medication? But here's the thing. For you guys that are on TRT protocol, so testosterone replacement therapy, or if you're female on HRT, right, bioidentical hormone replacement, and you have testosterone, exogenous testosterone that's replacing your natural testosterone. Most doctors, depending on the individual, the dosage, and their sensitivity to aromatizing testosterone into estrogen or estradiol in males, most doctors will prescribe a dose of anastrozole or Remedex, right? We call these AIs. They're going to inhibit aromatization and ultimately lower the serum levels of estrogen or estradiol in the bloodstream. So you've got to think about something like a blood pressure medication. If you're on TRT and as preventer, your doctor says, hey, take this Remedex. If you are putting your body through the intense stress and strain of a contest prep, wouldn't you also apply that same logic, right? And say, well, I'm going to preventatively or proactively make sure that my blood pressure is in check. So that's one way to think about it. But we did just talk about beta blockers. We talked about ACE inhibitors. And then another one that I would say as of more recent, within the last year or so, that I've seen really trending and starting to gain a lot of traction in the bodybuilding community is angiotensin 2 blockers, right? A lot of people abbreviate that to ARBs. One of the most common ones that you'll hear is telmisartan, right? 40 milligram or 80 milligram. And the way that these work, very similar to ACE inhibitors, they're actually going to bind to the ARB receptors, right? They are antagonists to aldosterone. They help relax blood vessels, allowing more blood flow to the organs, relieving pressure on the heart and kidneys, right? So overall, effectively, you're going to reduce your risk of a stroke or heart attack by something like telmisartan or any of those blood pressure medications in this class of angiotensin 2 blockers. So again, right now, ACE inhibitors, angiotensin 2 blockers, those are going to be your kind of top two that you'll see highly recommended for the lifestyle of a physique athlete. Very good all-around benefits to protect your organs and lower your blood pressure. Two more that we'll cover quickly: calcium channel blockers. Not my favorite for bodybuilding. They can hinder muscle contractile performance, right? So when you think about contractile elements within the muscles, calcium being required for part of that process, you certainly don't want to block that and cause any disruption or issues there. And they work by expanding or widening blood vessels and disrupting calcium movement within those calcium channels. So again, another form appropriate for certain people, probably not the first choice for bodybuilding. And then last but not least, everyone's familiar with diuretics. So, if you've ever landed yourself in the hospital, you've been really sick, you've got an elderly parent or grandparent that's been in the hospital, maybe they've got some cardiac issues, and they need to get the blood pressure stabilized and pull some water and some fluid off the body. You'll commonly see things like loop diuretics such as Lasix or Bumex, or the thiazide such as Diazide, right? A lot of these would be appropriate maybe in a hospital setting, but not so appropriate for daily use. Certainly not, right? You can cause all kind of imbalances such as potassium, electrolyte imbalances, dehydration, muscle cramps. Clearly not something that's conducive to a bodybuilding or physique outcome. Now, with all that being said, let's stop and think, who should consider using blood pressure medications? Well, just from my personal experience and anecdotes of being in the industry for the last 15 to 20 years, I would say the most common people that should be at least thinking about it, if you are 30 years or older, and if you're using exogenous hormones, you should be checking these things anyways. I think those are kind of like low-hanging fruit, right? You guys should definitely at least consult with a doctor and see how your biometrics look. Is this something that you should be even thinking about? And the other group of people or individuals that I would say certainly should be thinking about it at any age, if you are genetically predisposed to high blood pressure. So you're going to see this very common in a lot of African-American males. If I take my dad's side, African-American, definitely family history of high blood pressure from age 20 and up. So if you're genetically predisposed to it, you should already be having those conversations. But especially when you pair that with the intense training of contest prep for a bodybuilding competition. So those are the people that I think should start, but anybody could consult with their doctor and just at least keep, a good eye on all of your key health indicators. And just some general rule of thumb for you guys. If you're unsure, I recommend picking up a very cheap blood pressure cuff for home. Decades and decades ago, let's take the 90s that we talked about. It wasn't so easy to just have a blood pressure cuff laying around at home, right? You had the pump, listen to it with the stethoscope, not something you can really do yourself. Where today you can go to any Walmart, Walgreens, Amazon, order a blood pressure cuff for probably $20 to $30 and check it, monitor your trends over time, and see if there's anything to worry about. So when you're checking your blood pressure, if you're doing this yourself, your top number, that's your systolic number when the heart contracts. And then the lower number is diastolic when the heart relaxes. And there's some general guidelines on the ranges they like to see people in, with the caveat that over time, as your body ages and becomes less resilient, those ranges might start to increase just a little bit. But on average, good rule of thumb to start with, we like to see blood pressures within a range of 120 over 80. When we start to see numbers of 120 to 129 with the diastolic lower number at 80 or less, we'll call that a slight elevation, right? So slight elevation in the systolic number. You probably don't need medication for that. I would say put that on watch, right? Just observe your trend over time. And like I said, if you can take your blood pressure at home a couple times a week, monitor that over a month. Is it stable? Is it, maybe you just had a high stress day at work and it was high, but start to look at those directional trends over time. The next group up, let's say top number is 130 over 80 to a range of 139 over 89. We would consider that generally stage 1 hypertension. You might need medication. Now, this is where you're going to start to look at other things like the lifestyle, family history, personal history. And then, of course, if you start to see some elevation where you're at 140 over 90 or higher, that's what we consider stage 2 hypertension. Probably need to be medicated or make some significant changes in what you're doing, right? If those issues are solely being driven by exogenous use of supplements or hormones or things like this, it's as simple as having a discussion with your medical team, and a lot of times just changing your inputs, right? Changing the lifestyle or the things that are driving your blood pressure up in the first place. So highly recommend consult with your primary care physician or your cardiologist. Make sure that you educate yourself around this topic and do frequent blood work, biometric health screenings, and always be transparent with your care provider. If you guys are competing, share everything you're doing, from what supplements you're putting in your body, how hard and how many days per week you're training, what your diet looks like. We all have some pretty crazy diet at the end of a contest prep. So all these things will help them correctly diagnose and understand if you do need to be medicated or if it's just some simple lifestyle changes or dietary changes. So that's all I've got for today, guys. Again, if you've got questions specific to any of this stuff, always feel free to reach out to me direct. You can find me on Instagram at AndreAdams_official. I've got my link tree on there. You can see all of my medical partners on that link tree, or reach out for coaching inquiries or DM me for a message, right? More than happy to engage with you guys. And also, once this podcast airs, I'm going to drop some very nice references into the comments so that you guys can go check out some of the medical studies and references. There's a few from, PubMed, there's a few from Mayo Clinic, and a few others. So more than happy to share those with you guys. Thanks for tuning in, as always, on another exciting episode of the Peak Physique Podcast. We'll see you guys back next time.